Hello, friends. Welcome to Mind Parachute Show. Parachute works when it is open, so as our mind works when it is open. So, to open our mind on various aspects, I try to get best of the best speaker from the industry who are authority in that particular subject. And today we have a topic that is increased screen time and eye health. So discuss this topic on Mind Parachute Show. We have a very dear friend, Dr. Deepak Garg on Mind Parachute Show. Doctor, welcome on the show.
Thank you for having me here.
Dr. Garg is eye surgeon. So before I start shooting my question at Dr. Garg, let me first introduce, and before that, let me request all live audience to please like Facebook page of Mind Parachute Show and also subscribe to YouTube channel of Mind Parachute Show. So Dr. Deepak Garg is an avid runner, tracker, and a fitness enthusiast. He is a squint specialist and a cataract specialist. After finishing his education from esteemed Sankara Netralaya in Chennai, he visited 6 different squint specialists in US, Canada, and UK. And then he established Eye Solutions, a state-of-the-art chain of eye hospitals in Mumbai in the year 2008. Currently, Eye Solution, that's Dr. Deepak Garg's baby, has 3 branches in Mumbai, uh, that is Kames Corner, Kandivli, and Majgaon. So that's Dr. Deepak Garg, who is expert and authority on the current topic. So Dr. Deepak Garg, once again, welcome on Mind Parachute Show.
Thank you so much for having me.
Yeah. So my first question to you is: does increased screen time lead to child getting glasses? Because nowadays we see lots of online education, work from home. Lots of things are going. So child and adults. So increased screen time is an issue for child.
Yeah, so screen time is a type of near work. Okay,
Mm-hmm.
reading a book is also near work. And what
Mm-hmm.
studies have shown is that increased near work leads
Mm-hmm.
to increased risk of developing minus numbered glasses. Okay, in a
Okay.
technical language, that's called myopia. So the more the near work you do, the higher the chances that you'll develop myopia. And this has
Mm-hmm.
actually been proved by studies. So using the
Mm-hmm.
computer a lot is basically doing near work, right?
Okay.
So if it is not accompanied by far work,
Mm-hmm.
like looking out of the window or going down to play or something, then the chances of getting glasses do increase. In the
Okay.
case of adults will not really get glasses if they spend a lot of time on the screen because their eye growth has already stopped,
Okay.
right? So they are not going to get glasses, but yes, the risk does remain in children. However,
Mm-hmm.
I would like to add here that it doesn't mean that just because they start spending a few hours extra for a
Mm-hmm.
few months, your child is
Mm-hmm.
going to get glasses.
Okay.
Yeah,
That's a good
unfortunately,
news.
because
That's a
yeah,
good news.
that's a good news. Unfortunately, the fear factor has really hit us, the parents at home, and everyone is so worried. So my
Ah,
intention is to actually reduce that worry because it's not really worth it. Nothing's going to happen in a few months of extra screen time.
correct, correct, correct. So, what measures can parents take to limit the damage to the eyes because the kids are at growing stage? You know.
Yeah. See, when you are on the screen,
Hmm.
the first thing you can do is take a break for every 30 minutes.
Okay.
Okay, and what we want during that break is we want the children, actually this applies even for adults, we want them to look far away. So maybe look out
Mm-hmm.
of a window, you know and for younger children who are very young and still on the screen because of online schooling, you may not be able to tell them to look out of the window or something. And in that situation, you could, even if you distract them, and even if they
Mm-hmm.
just get away from the computer, that's good
Mm-hmm.
enough.
Okay.
All right, that is the first thing we can do. The second thing is to for children especially, they need to go outside the house for 1 hour a day, outdoor activity.
Mm-hmm.
It's really, really important. They need to spend time outdoors. And what they do in that time is they tend to look at very far things,
Mm-hmm. Mm-hmm.
and that
But
actually
the
helps
problem
in.
is, but the problem is now we all are in we are facing a very odd situation. We are locked. You know, we are in lockdown. So God knows when this lockdown will completely unlock. Especially in my society, no kids are coming down. You know, they are not playing. They are not coming out of their homes also because of fear. You know, nothing, anything can happen. I mean,
Yeah, yeah, I
nothing is
understand.
predictable. So, going out is not a solution today in lockdown. Then
Yeah.
what? Are there any specific exercise, eye exercise, which can help, kids to maintain a good health of their eyes, or even for the matter for the adults?
Yeah. See, there are some schools of thought, they are called
Mhm.
yoga centers,
Okay.
which claim that some eye exercises may actually help in reducing the eye number. Now,
Hmm.
the specialty that I come from, we are allopaths. We practice allopathy, and in
Hmm.
allopathy we believe in evidence based medicine. We need some proof of something. A
Hmm.
scientific study has to be done for us to change the way we practice. So the
Hmm.
so we don't believe in any exercises, but what we do believe in is that looking far away is the most important thing you can do, even as
Okay.
adults. And what
Okay.
this looking far away does is, whenever we look at a screen, we want to see the screen clearly.
Correct.
Because we want to see the screen clearly, we are straining our eyes all the time, right?
Hmm.
Now, that constant strain leads to eye strain, leads to fatigue. You feel tired, you feel, like closing your eyes or whatever. Now, when we look
Hmm.
far away, the entire action of the muscles is reversed.
Hmm.
So the
Okay.
eye actually, yeah, so the eye actually gets a break from
Oh,
that. Yeah, so it reduces eye strain significantly for both
wow.
children and adults.
Just by looking far,
Yes,
the whole eye, muscles gets, some kind of
relaxed.
exercise, some kind of
Yeah,
relaxation. So
yes,
that is very easy. So I mean, even if people are in lockdown, they can just look outside from their window, try to look as far as possible. That will
yes.
eventually give exercise to their. So for how much time it needs to be done?
So every 20 to 30 minutes, if they take a
Mhm.
break for a few minutes and do this, they are
Okay.
fine. So this is, of course, this is only true for people who spend, 5, 6, 7, 10 hours on the computer. If you're
Okay.
not, yeah, if you're not spending that much time, then you're anyway fine. Then nothing is happening to your eyes in any case. But if you're spending 5, 6 hours, especially children, then what we want is, we want them to take a break every half an hour and look
Mhm.
outside the window.
Okay. So for kids, every half an hour, 30, 40 minutes, they should take a break, short break, and just look outside the window and try to see
Yeah,
as
yeah,
far as possible, so that
yes,
the whole the mechanism gets some kind of
yes.
exercise, and that maintains or build the health of our eye system. So I think then it is same for even adults. Let's say if
Yes.
I'm working on a laptop for long hours, at least I spend 8 to 9 hours in a day in front of laptop. So it is same exercise for adult too.
Yes, yes. It will significantly reduce your eye strain, and the fatigue that one feels after spending 7, 8 hours on a computer, that will actually significantly reduce. So it would be of great benefit to even adults.
Okay. So since we are talking about computer, my next question to you is: are there any filters on computers that can be used to reduce this kind of stress or strain?
See, there are filters available in the market.
Mm-hmm.
Uh, they, I don't believe that they offer significant benefit.
Mm-hmm.
Okay, what one can do, both children and adults, is they can actually reduce the brightness of the screen
Okay.
to a level that they are comfortable with. Many a
Okay.
time we are using the computer and we just forget, or we don't remain aware of how bright the screen is. But if we were
Mm.
to reduce the brightness a little bit, we would still be able to comfortably read the screen, right?
Mhm.
So if they do that, it will again help in reducing the eye strain that may happen after prolonged screen time.
Okay, okay. So, if there are any filters available, they can check online also, because going market again in lockdown is not possible. So, just check it on Amazon. Can you recommend a few?
See, as I said, these filters, I don't think
Hmm.
they add any value.
Okay,
So I personally don't know anything. I can recommend some drops and all that later in the show, in your
okay,
show,
okay.
but these filters I have no clue about because I don't use them myself.
Okay, I heard. You see, I use spectacles. You got spectacles. So
Yeah,
spectacle comes with blue light protection and all. So I
yeah,
have one which has that kind of protection. So
yeah,
how far it is correct that blue screen protection helps to the
yeah.
it helps my eyes to protect from this blue light. I'm not really sure how what the blue light and all about, but whenever I go and meet someone, whenever I want to change my spectacles, so the guy always suggests me, sir, why don't you go for this kind of glasses which has got this filter, that filter, and especially since you are operating more on computer, why don't you use this glass? It protects your eyes from blue light. So what is this blue light coming out of computer, and how does this special glasses will protect my eyes from any defect or any damage?
Yeah, this is one of the commonest questions we are being asked actually. Every day,
Okay.
someone or the other will ask us this question. See, blue light is present everywhere. It's not
Mm-hmm.
only coming from a computer. Unfortunately,
Mm-hmm.
people have come to believe that blue light only emanates from a computer screen or a phone screen. Actually, sunlight has blue light in it. Okay,
Okay.
so blue light is everywhere. And
Mm-hmm.
blue light has a property that it can actually penetrate all the way inside the eye and even hit the back part of your eye, which is called the retina.
Uh-huh.
Okay, and that's nothing wrong with all of that. Now what
Uh-huh.
blue light can do is or rather what blue light does is it reduces the levels of a hormone in our blood. The name of that
Mm-hmm.
hormone is melatonin. Okay,
Okay.
and that hormone actually helps in us with our sleep, with us sleeping
Okay.
well. All right, so
Okay.
if you use the phone a lot, let's say, then because
Mm-hmm.
of the blue light, if your melatonin levels drop, then
Mm-hmm.
there is a possibility that your sleep will not be that great.
Mm-hmm.
Okay, so one claim or one blue lights are supposed to improve your sleep. Okay, what I will
Okay.
tell your viewers is that there is definitely no harm in using the blue light blocking lenses. All
Mm-hmm.
right, there is
Mm-hmm.
zero harm. They, if at all, they may only benefit you, but I do not think that the benefit is significant. Okay, and the reason for that is that if one is not sleeping well,
Mm-hmm.
blue light is not the only reason for that poor quality of sleep. Okay, there could be
Mm-hmm.
other reasons which are probably more important. You could be having dinner late. You could, you should actually, we ideally we should not have coffee or alcohol before, just before sleeping.
Okay.
Suppose there are a lot of things on your mind, of course work
Mm-hmm.
stress is there, and if you're not
Mm-hmm.
figuring out ways of dealing with all of those things, then of course
Mm-hmm.
our sleep quality is reduced,
Mm-hmm.
right?
Correct.
These things to my mind are much more important for for quality sleep than blue light.
Okay.
Now now every day I'm being asked this question, and this is what I tell whoever calls me up, and people are still buying the glasses, which is fine. So they are buying it actually because sometimes people need a placebo effect. They want to feel that they're doing something for their kids or for their loved ones. They feel, they want to know, they want to feel that something they are doing and taking care of people's eyes. So maybe, yeah, so people are using those, and as I said, there's no harm. I just think
Mm-hmm.
that there is no significant benefit either.
Oh,
Yeah,
for
yeah.
just one feature, the glass cost significantly goes up.
Yeah,
And when the
I know.
cost goes up, as a consumer or as a customer, we start thinking, oh wow, this one feature can save my eyes, so why don't I upgrade? And see, every month people don't change glasses. It is only when they feel okay, my eyes are straining, the water is coming out, and I need to go for an eye checkup. And then that ophthalmologist, uh, he will guide me something and tell me something, and then I okay buy his argument, and eventually I buy that expensive product. And why it is
Yeah,
expensive? He convinced you so nicely, this has got this benefit, this has got that benefit, and then you know
yeah,
200,
yeah,
2000, 5000, whatever the cost is, you are sold to that idea. So practically the point taken, practically blue light protection actually doesn't happen. This is what I feel. So I will not name brands, but I will tell you, I bought spectacles and the glasses with blue light protection. That company, which is a brand, I will not name. That company said this is giving you protection from blue light. Point taken. Okay, I bought that. Then I went to another brand. There he used one specific torch which from which blue light emits, and then he tried on his glasses, which protected that light to pass through. But when he tried on my glasses, which is supposed to be a blue light protection, it didn't work. So I am really not understanding what is actually
yeah,
happening. So
yeah.
is that light also specially made to pass through some glasses or not pass through some glasses? Is it like that?
No, I don't think so. I don't think that's the case. I don't know what happened in this in the situation that you just described, but I don't think that's just bad luck. Sometimes they use, it's we have to be smart about these things. We have to realize that at the end of the day, there's a lot of marketing that's happening
Correct.
with all of these things, right? As I said, there's no harm. I have some very close friends also who wear these, and they actually feel that they are being benefited by this.
Okay. Do you
So
wear blue light protection
I don't,
glasses?
I
You
don't,
don't. Okay, point
no, I
taken.
don't,
But
I don't.
I will discuss this offline with you after the show, so that we
Yeah,
can debate
yeah,
on that.
yeah,
So there are
yeah,
some
yeah,
questions from audience before I go ahead with my next question. Let me take
yeah.
my audience question. Mahesh Dighe is watching this show. Thanks for watching it. Hello, doctor. Any diet we should follow for better eyesight?
Um, okay, so this is a interesting question. Now, one thing you have to understand that people talk about eating carrots. Everybody has heard
Yes.
of that,
Yes.
right?
Yes.
And we talk about eating carrots because carrots have vitamin A.
Mm-hmm.
But carrots are not the only source of vitamin A. There are many fruits and vegetables actually that have vitamin A.
Mm-hmm.
When whatever we read about in terms of supplements or in terms of nutritional requirements for the body are mainly for undernourished people.
Mm-hmm.
So suppose you say ki carrots khao, it is actually why they are saying all these things is because in we unfortunately we do have people in our country who are undernourished.
Mm-hmm.
People like you and me usually don't need anything extra,
Okay.
right? So suppose your eyes are fine today, and
Uh-huh.
if you have two carrots extra every day, they're not going to become better.
Okay.
They're going to remain fine only. Whatever their best, they will perform to the best of their ability, which is 100%, let's say, right?
Mhm,
And
mhm,
you are not going to face any uh, negative effect because you didn't have an extra carrot. Okay. Now that being said, there is another interesting thought about this aspect, and that is that there are stories, or there is literature saying that the the ground quality our earth quality has obviously gone down over the years after so much cultivation. And what they are saying is that the the quantity of nutrients may not be like what they were many years ago. On the other
Correct.
hand, there is a lot of research happening in
Mhm.
agri sector, which may
Mhm.
actually add nutrients to the food. So you may have, a carrot with some extra vitamin A, or you may have something else. So it's not very easy to answer that question unless you are really up to date with the research on that. As regards your question, there is no special diet needed for to maintain good eye health.
Mhm.
If at all, the one thing that you really need to do to maintain overall health and eye health is to have enough water. We
Enough
all
water.
actually, yeah, we all actually have very less water compared to what we should be having. So
Mhm.
that is something that we can all think about.
Okay. So having more water is the suggested, you know,
Yeah.
one of the diet option. Okay, which is very
Yes.
easy.
Yes.
You can just
Yes.
have a every half an hour and you know uh, keep dehydrating our body, right? And carrot, yes, I have been listening and following these things from my childhood time.
Childhood. Yeah.
My,
Yeah.
my
Yeah.
granny used to tell me eat lots of carrot so that your specs can go. So let me ask you a very funny question. I already got specs, almost it's 25 years now, for example. Okay, if I consume more vitamin A, will it help me to overcome my spectacles? Will it
No,
go? My number
unfortunately,
will
no, it won't go. These are all myths actually that have been carried on for generations in our country, and I'm sure that it's true in other countries also.
go?
But the glasses won't go. What glasses are there because of the shape of the eyeball? So
Okay.
if my eyeball is longer, I get a minus number. If my eyeball is shorter, I get a plus number. Okay.
Mm-hmm.
Now, by having extra vitamin A or any other vitamin or nutrients, the length of the eyeball is not going to change.
Okay, it's not going to,
Okay.
but yeah, and by doing exercise, let's say looking, seeing far distant places, will that exercise help, reshaping the eyeballs?
No, no, no. It
No.
won't help.
So
No.
once you
What the
have specs, you have specs forever. Or
Yeah.
I think then there are some surgery, laser surgeries and all, by which you
Yes.
can correct your vision.
Yes. So those laser surgeries, one of the, there are a few names and a few types,
Uh-huh.
but for the sake of this discussion, let's call it LASIK. Okay. LASIK
LASIK.
is the name. LASIK is the name of this laser surgery to get rid of the eye number. And what
Uh-huh.
happens in this laser surgery is that the cornea, which is the frontmost layer of the eye, okay, it's
Mhm.
actually the black part that you see in the eye, the cornea is actually in front of it, and it's
Okay.
transparent. Okay, it's
Okay.
transparent. It's like a clear
Mhm.
piece of glass. And what the laser does is it reshapes that cornea.
Okay.
Okay, so basically, whatever lens we are wearing in our glasses,
Mhm.
that number is actually in a way incorporated in the cornea by reshaping
Okay.
it. However,
Okay.
this reshaping is happening at a micron level.
Okay.
Like it's happening at, they remove 10 microns, 20 microns of the cornea and reshape it. And that
Mhm.
much of resurfacing will actually help you get rid of your glasses.
But is it permanent or it will come again? The number will
Okay,
come again.
so yeah, so once you get the laser done,
Mhm.
you will get reading glasses again at 42 or 43.
Okay.
Okay, so suppose let's say a 20-year-old person decides to get a laser done to get rid of his glasses, he'll be
Mhm.
fine till 42, 43 years of age, after which he will get a reading number.
Okay. That means
Okay?
plus number, not minus number.
Yes, and that also for near, only for reading.
Only for it. So for far distance, he will never have glasses.
No, so for far distance, when that same person becomes, let's say, 55, 56, 57,
Uh-huh.
then that same person will even get a number for far, because at that age, a cataract starts developing in the eye.
Okay.
Okay, and a cataract causes this number change at 50, 55, 60. So in short, if let's say a 20-year-old decides to get a LASIK done,
Mm-hmm.
that person
Mm-hmm.
will be glass free for about 20, 25 years,
Okay.
till 40, 43 or 45.
So if a person like me who is 40 plus, you will not advise me to go for LASIK.
No, no. People do get it done. Uh,
Uh-huh.
there is nothing medically wrong in getting it done.
Mm-hmm.
Okay, so it's not like a wrong treatment.
Mm-hmm.
It's more actually a personal choice. It's your choice. If you become really keen to get rid of glasses,
Mm-hmm.
then you can of course take that decision and get it done for yourself. I
Mm-hmm.
just feel personally that there is no bang for the buck. You're not really
Oh,
becoming glass free. You know, in 1 year
okay.
you will still be wearing reading glasses, and if you're
Okay.
wearing reading glasses, it's very difficult to, you know, wear reading glasses, and then if you want to look far, you have to take out the glasses and look far, and then again wear it when you want to look at the screen or read a book. It's not a very practical thing to do. So
Mm-hmm.
because it's not practical, then some people actually end up wearing progressive lenses, and after
Yes.
getting a LASIK, they are basically back to wearing glasses all the time.
Okay.
So I just don't think it makes a lot of sense for people to get it done after 45, 46. It's not really fun.
Okay. So since we are talking about glasses, there's one question from Dr. Suresh Kotti, who's a spiritual guru, divine powers, and he's a sound therapist. He's asking Dr. Deepak, please throw some light on pinhole glasses. Well, I'm also not aware. So whatever you will be
Yeah,
talking, it will be a new knowledge for
yeah,
me.
yeah. So pinhole glasses, sir, when we actually examine patients in eye hospitals, one of the techniques of examination is by using a pinhole. What
Mm-hmm.
that what the pinhole serves, the pinhole serves a particular purpose, and what it does is it cancels out. So if this is a pinhole and there's light coming into the pinhole, it cancels out all the rays of light which are around. It only allows those rays of light to come into the eye which are almost straight. Any bent ray of light hits the edge of the pinhole and is not allowed to enter the eye. And what happens with this is that even if you have a number of under, let's say, 2.5 or 3, then if you wear a pinhole glass, your vision improves.
Okay.
So, Milind, for just for your information and for the information of other viewers, a pinhole is nothing but a pinhole. Matlab, it is a piece of, let's say, a black disc. It's a complete black disc with an actual hole in the center. There is no lens, there is nothing. If I take a piece of paper and I make a tiny pinhole in it and I put that paper in front of my eye, that will become a pinhole glass. Okay.
Okay.
Yeah.
So it
Okay.
does not
So
have any number at all.
nothing, nothing, nothing. But it will give you clearer vision than when if you did not have the pinhole. Okay,
Okay.
but it may not give you crystal clear vision.
Mm-hmm.
Okay, and it may not work for those people who have very high numbers. So if you have a number of more than four, then
Mm-hmm.
your vision will become better, but it will not become 100% normal.
Okay, so here I have one query. When I go for my eye checkup, they use specific device to take the number. So then there's a machine. I have to sit in front of it, and then it gets covered, and then they throw some light out from it, and so that process is also pinhole testing kind of process. Is it something like that?
No, pinhole is different. It's a more manual. It's a part of the manual examination of our eye number. The
Okay,
machine uses a different technology to actually measure your number. Both are
okay,
equally important.
okay.
Yeah.
Both
So
are equally important.
yes, you have to undergo both to be able to reach a accurate prescription that we can actually give you, which you can use to, to ensure to your optician to get new glasses made.
Okay. Thank you, Dr. Kutti, for asking this question. So, moving forward, since the topic is about screen time, next question to you is what is the maximum amount of screen time that child can have?
Okay, so there have been guidelines that have been
Mhm.
issued by the really large pediatric ophthalmology associations. Okay,
Mhm.
so the American Academy has issued some guidelines, and these are only guidelines. They are, you can call them as suggestions. They are not
Mhm.
really rules. It's difficult to make rules for this kind of a thing because it's very difficult to do studies. You cannot do you can't do study over 30 years. 30 years later we will know what the effect of screen is, but now, you understand what I'm saying. But what their guidelines say is that 0 to 2 years should have
Uh-huh.
zero screen time.
Okay. Okay.
Okay, should have zero screen time. 2 to 4 years should have 1 hour a day, and 4
Mhm.
to 6 should have 2 hours a day.
Mhm.
Above 6 can have more than 2 hours a day, maybe 3, maybe even 4 hours a day.
Mhm.
Okay, but as I said earlier in your first when I answered your first question, that doesn't mean that if your child spends half an hour more, a few days, that something terrible is going to happen.
So lockdown is not going to happen forever. So after maybe 2 or 3 months more, we all may be free once the vaccination is released.
Available,
I think
yes.
we all will be out of all this pandemic situation. So moving forward with what we just discussed, there's a query from Mr. Pawan Kumar Shukla. Thanks, Pawan, for coming on the show. In this pandemic, my kid is 5 year old. She is unable to go out. Okay, she spends more long hours, and the screen time has increased. So how to handle this situation? Many things are
Yeah,
already answered, but still, yes, you're short on this
yeah,
question, doctor.
yeah. I'll summarize it. So the first is to take a break every half an hour.
Hmm?
So tell your child to, she's your child is obviously very young. So even if she takes a break and you don't tell her to actually look far out of the window, that's fine. So every break every half an hour. The
Mhm.
second is to um, actually we should be blinking very often. Now again, your child is young, so for a 5-year-old child to keep telling them to blink may not be practical. So what we have to do is, when they are sitting on a screen, we have to distract them. So suppose a child
Okay.
is sitting next to you and you kind of talk to the child looks at you. When the child looks
Ah.
at you, they will look away from the screen and they will blink a few more times than what they would have done if they were looking
Mm-hmm.
at the screen,
Mm-hmm.
right? So that is the other thing. The third is, we should not ideally sit under the direct blast of an air conditioner.
Okay.
Okay, so that will also actually aggravate the dryness that happens when we are looking at a screen. Okay,
Oh.
the fourth is the most important thing, which I was telling Mr. Milind earlier, is that ideally, I don't know if your building allows it or if you have a garden, but actually your children should spend 1 hour outdoors every day. It's actually
Mm-hmm.
really important. And it's
Mm-hmm.
important at multiple levels, not only because of the eyes. It's important because it helps in just for them to get out of the house. It helps
Mm-hmm.
them psychologically,
Mm-hmm.
of course health because of movement and exercise, but it helps the eyes because when they go down and when they are playing in a garden, they actually look very far away. And when they
Correct.
look far away, as I was telling you earlier, Milind, it reverses the action of the muscles
Mm-hmm.
uh, compared to what they were doing when they were looking at near the screen all the time.
So that's the best exercise. So the friends, the best exercise today suggested by Dr. Deepak Garg is try to see things which are very far. That gives best exercise to your eyes. And as far as possible, keep drinking water, keep dehydrating your body so that it helps entire body to function well. So based on this body function, there's a next question by Captain Bala. Captain Bala is you know very senior and uh, you know is very special guest. His question is good to hear you, doc. Informative. Does the cornea heal itself if damaged, like other human body parts? He has served Air Force and he's one of the Veer Chakra awardee. So thanks, Captain Bala, for watching this show.
Thank you, sir. So, cornea injuries or corneal injuries can be of various types. Okay,
Mm-hmm.
the mildest form of corneal injury and the most common is actually something that we call as epithelial defect. Okay,
Mm-hmm.
now the cornea has 5 layers. If the frontmost layer comes off, that can heal very easily on its own. But any other layer, if it is damaged, it can heal a little bit on its own, but there may be a scar that remains. So just like if I get cut on the hand, on my hand with a knife, the wound will heal. I'll put medicine on it, I'll take tablets and everything. The wound will heal finally, but there will be a line there. Similarly, if the deeper layers of the cornea are affected by anything, it could be, in children, what we see is we see bow and arrow injuries. The kids play with these toy bow and arrows,
Yes, yes.
and you'll be surprised. Of course, we see injuries during Diwali, and we see injuries with things like paper.
Mm.
If the I was just telling my son that be careful when he's playing with playing cards. So
Oh,
the edge of the playing card, if it hits the eye at a perfect angle, it can actually behave like a blade.
oh,
So the cornea can get injured. But as I said, if the only the front layer is damaged, then what we do for treatment is we only patch that eye like a pirate. So we just cover
mm.
the eye, put tape over it, and in 12 to 24 hours, it completely heals.
Oh,
However, if there are deeper injuries, then of course it depends on how deep the injury is, whether the injury has any infection or no. Then I wouldn't say that then the cornea heals on its own. Then the doctor has to do something to help it heal.
wow. I'm sure,
Yeah,
Doctor,
and so,
this explanation has helped Doctor Captain Bala, and it will help. Yeah, you're saying something.
yes, I was also saying, of course, in the very severe injuries in which the cornea actually tears, so it becomes like a through and through injury. So if the
Mm-hmm.
cornea is so thick, if the whole thing is torn, then it's like it's like the eye is now open. Earlier it was a
Mm.
closed wafer packet, let's say. Now it's open, and that is of course a very 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 grievous injury, and it's a medical emergency that of course needs surgery. There's no other solution for that.
Wow. Okay. Thanks for this information, Doctor. And the next question is coming from Ashutosh Naik. Hello, Doctor. Any guidance for kids classes? Children are now on computer screens for online school classes. This is a common problem now, and that's why the topic today is screen time and eye health. Very good question, Ashutosh.
Yeah, so any guidance for kids glasses? Okay, so first thing I'll talk to you about, which we've already discussed, is the blue light blocking lenses, right? And the blue
Mhm.
light blocking lenses, they do not cause any harm, but I don't think they significantly offer any benefit either. Okay, uh, so that is one thing. The other is there is a smaller, or rather I should say there is a slightly increased risk of our children getting glasses if they're on the screen all the time, but that increased risk is not as much as we all think.
Mhm.
Okay, there are other factors too. Genetics plays a very important part in us getting glasses.
Okay.
Okay, height, growth in height or a spurt in height actually plays an important part in us getting glasses. Not only just suddenly if your child has spent a few extra hours for a few extra months on the screen, it's not like he or she is going to get glasses. Okay,
Okay. So that's a good news.
and
That's a good
yeah,
news.
yeah.
Not to worry at all.
Correct. That's my idea actually, because
Yeah.
there's a lot of worry amongst parents regarding this. And finally, if your child has numbered glasses already,
Mhm.
then of course it's important that they wear those glasses so that they can see clearly all the time, and that there is no eye strain when they're trying to look at the screen or the television.
Okay. So now, see, the problem is since the fear has come in the mind now that because of increased screen time, kids may tend to have glasses and all. If at all, if if eyes are paining, or if at all something not good, it is not in order. So in this pandemic time, is it a good idea to go out and get the eyes checked up? What do you suggest on this?
Yeah, so most of the eye hospitals or the eye clinics are actually standalone clinics, right?
Mm-hmm.
Ophthalmology is not a very big specialty in general hospitals.
Mm-hmm.
So, if I had to also go to a general hospital today, I would think 10 times, because that's where all our COVID patients are being admitted. And obviously the risk is more, there's no doubt about it.
Mm-hmm.
In an eye hospital, that risk actually is not there. Every eye hospital is actually screening patients before they enter the hospital to make sure that they don't have COVID symptoms. And if
Okay.
they don't have COVID symptoms, only then people are entering.
Mm-hmm.
Uh, Many hospitals are also testing their staff and making sure that nobody, has fever or, things like that. So
Mm-hmm.
getting an eye checkup at an eye hospital, I don't think carries significantly extra risk. It of course
Okay.
it's riskier than sitting at home. There's no doubt about it. Okay, I
So
mean, if you
if
sit at
there
home,
is any symptom of getting glasses, and we are not just sitting and we are not going and getting it checked up, probably the number may increase also, the more
no,
damage
no,
may
no,
happen. Is it like
no,
that?
no, 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 no. I meant that it is sitting at home is the safest. That nothing can
Huh.
beat that. But there's a
Huh.
limit of how much you can sit at home and how long are you going to suffer for all other aspects of your health. All right.
Correct.
So if
Correct.
you have to go to an eye doctor, then you can go. But if you're not being able to see clearly, and if you think you have glasses, and if you're not wearing your glasses, it's not like your number is going to increase. It's not like the eyes are going to go bad. All right.
Hmm.
It just means that you're going to strain your eyes to see clearly,
Oh, oh.
which is a temporary thing.
I have one question and one complaint. You know, when I was child, my doctor said you got a number, and if you wear your glasses continuously, eventually after some period, maybe a year, 2, 3 years, your number will go. So you will be specs free. You know, but even till today, it has not happened.
Yeah, that
So
never
what?
happens. That never happens, unfortunately. I don't know. I think times were different, 20, 30 years ago. And so doctors used to say that. I know that. But
Uh-huh.
it doesn't happen. And we don't even say that to our patients anymore.
Now
In
you don't
fact,
say.
yeah, in fact, parents they think that it'll happen, right?
Uh-huh. Uh-huh.
Just like you were told in your
I'm
childhood, I'm
still
sure.
waiting. I'm still waiting when my specs will go.
Yeah,
My number.
yeah. Everyone else was told the same thing, that you wear your glasses will go away. That doesn't really happen. So glasses
Mhm.
are going to remain forever for most people.
Okay, okay. So, if there are any issues, if there's a itching or continuous headache because of increased screen time and all, would you advise some eye drops and all, so that
Yeah,
instead of going out and getting eye check, if something can be done at home, like
yeah. So
preliminary
what
level.
you can do is, you can, of course, as I said, first blink very frequently, consciously increase your blink rate, because when we look at the screen, what we tend to do, both adults and children, we tend to blink very less,
Mm-hmm.
and this decreased blink rate leads to dryness.
Oh.
Okay, so the first thing is to increase your blink rate, take a break every half an hour, drink a lot of water,
Mhm.
and then we can use eye drops if you're not better. So these eye drops called lubricants. They may be like 100 brands available in the market. They are all over
Mhm.
the counter medications, so there's no
Mhm.
prescription needed. I will name a few
Mhm.
common ones, but you can of
Okay.
course ask your doctor or even get these. It's like they're harmless. So one is
Okay.
Refresh Tears. Refresh Tears is a
Refresh.
then there's Max Moist, there's
Okay.
Genteel,
Mhm.
there are multiple, there's Just Tears.
Mhm.
There are multiple brands available in the market. The higher end ones are Sustain and Optiv.
Mhm.
These are nothing but they're not, it's not water, but you can think of them as water, because all they do is they coat the front surface of the eye with a layer of fluid, which doesn't go
Mhm.
away very easily,
Mhm.
right?
Okay.
The only thing to remember with these drops is that if we use them once or twice a day, like many people do, they may not really offer any benefit to you.
Mm-hmm. Okay.
Okay, if you really want benefit, you have to use them at least 3, 4, 5 times a day.
Okay.
And one drop is fine, one drop each time. So roughly, let's say if you use them every 2, 2.5, 3 hours, you will get them
Mm-hmm.
4, 5 times a day in your eyes, and that will actually significantly help you with your dryness, eye strain, the feeling of fatigue. Sometimes people get up feeling they haven't slept very well. That's actually one of the symptoms of dryness.
Oh.
All these things will reduce over time.
So one drop at least 4 or 5 times in a day. If
Yeah,
five that if 5 times one drop, that means 5 drops. Don't put all 5 drops in one go and then don't use it.
expect.
Don't do that,
Yeah,
and don't
exactly,
expect good results. Okay. So
exactly.
why? So I mean, the effect to come, you need to apply that lubricant at least 4 or 5 times. That is the method to use it, right, doctor?
See,
Okay.
when we are on the screen, we are blinking. Our eyes are continuously becoming dry. Now,
Mm-hmm.
you cannot say that I want to use the screen also. My eyes will become dry also, but I don't want to use drops also. So it's like, in other words, I can give you an example. So if suppose I run a lot, all
Uh-huh.
right, and I want to keep running more and more and more, but I never
Mhm.
ever want to get injured.
It's not possible.
It may not happen. There may be a time when I will get some ankle injury, I'll get a knee injury, something may happen. Now
Correct.
I'm going to fix that, right? I'm going to fix my knee, I'm going to fix my ankle, either by surgery or by resting it or doing something. Now when somebody
Correct.
has dryness, nobody wants to fix it. They want
Correct.
they have to keep using the screen, because frankly speaking, it's not like we have a choice,
Mhm.
right? We all have to use the screen. So then you have to use the drops. It'll actually significantly help you.
Mhm. Mhm. Now, moving forward, my next question is, which is worse, TV or computers?
Yeah. So good question. See, computers, we are using computers at a distance much closer to us, right?
Hmm.
So it will fall in the category of near work,
Correct.
or let's
Correct.
say, or intermediate work. Okay.
Correct.
TV, on the other hand, is at a far distance,
Mm-hmm.
right? That is the main difference between a computer and a TV. There's no other difference really. Okay.
Mm-hmm.
The one other difference could be that when you're on a computer, you may be straining your eyes more to see things clearly.
Mm-hmm.
Okay, so you may be, for kids, for example, they are doing schoolwork, so they are reading documents, they are reading emails, they are, that is causing more strain. The television, on the other hand, you're maybe watching a cartoon, let's say, right? Kids are
Mm-hmm.
watching a cartoon, or we are watching a movie or something. We are not really straining our eyes to see everything crystal clear,
Okay.
and we are looking far away rather than near, which is why I've been telling parents that if their kids are on the phone,
Mm-hmm.
or when their kids are not doing schoolwork, if they are watching, let's say, a YouTube video or some cartoon, then
Mm-hmm.
it's better to cast that content onto the television,
Okay. Okay. So
so
you can
that
have
at,
a smart TV for that, or if you have a regular TV, you can use Chromecast or
Apple
Fire
AirPlay.
Stick, AirPlay,
Yeah,
whatever
yeah,
way you can convert your smart, normal TV into a smart TV. That is very much possible. So you advise to have a distance, little
yes,
distance. Okay.
yes, yes.
Okay. My last question now is having one type of number worse than having another type? That means plus number, minus number. So can you please
Yeah,
enlighten us on this?
yeah. See, there are basically three types of numbers.
Hmm.
Okay, one is a plus number, one is a minus number, and the third type of number, we call it as a cylindrical number. Okay,
Yes.
all the numbers that we have, all of us have, are because of the shape of the eyeball.
Okay.
Okay, so as I told you earlier, if my eyeball is, I don't know if you remember your ninth and 10th standard physics. So in our physics class, if you remember, we used to have these concave
Like
lenses, convex
contact
lenses,
lenses. Yes, 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 yes.
right? So there's a convex lens and two parallel rays of light come and then they bend and touch. Now
Yes, yes, yes.
the eye is like that, right? So
Hmm.
basically, if you have a eyeball which is very long, then the rays of light are not meeting at the correct point on the retina, so you have to wear a minus number in front of your eyes. If your eyeball is short, you have to wear a plus number.
Uh-huh.
Sometimes the eyeball is shaped like a rugby ball instead of like a football. Okay, so instead of
Uh,
being a perfect round, sometimes it's a little oblong. In that case, we get what is called as a cylindrical number. As I said, all these numbers are because of the shape of the eyeball. So there is no good number or there is no bad number. Okay,
mm-hmm.
it doesn't mean anything at all. The There is a slight difference, however. If you have a minus number, there is a chance that the minus number will increase.
Mm-hmm.
The plus number, on the other hand, there is a small chance that the plus number will decrease in a child,
Okay,
but it mostly won't go away. And a
okay.
cylindrical number, which is the third type of number, doesn't really change. It remains almost the same.
Wow, wow. That is so nice of you, Dr. Deepak. You have given too much knowledge on screen time and eye health. What is my learning is first, as far as possible, try to look at far distance. Okay, that is the best exercise your eye can
Taking a break.
have. Frequent breaks. Okay, then frequent blinking will hydrate your eyes, and if at all you need any eye drops, few names you are suggested, but use it at least 4 or 5 times, and one drop is enough. Okay, having water, that is the best medicine for any kind of body disease. So having water at regular intervals and good amount of water, that is best thing. So these 5 things I have learned today on this live show. Believe me, blinking solution was not known to me, so though it is so easy. Okay, looking far gives exercise to eyes, even that was not known to me till today. So easy thing we learned today on this show. Medicines, cataract, lasik, and everything is fine. Okay, these are some advanced things which only doctor can perform, but blinking every human can do, drinking water every human can do, looking far every human can do, and these are the best things to exercise eyes. So I'm sure, friends, you have got lots of input today on this live show from Dr. Deepak Garg. He is owner of Eye Solutions Hospital, 3 hospitals in Mumbai. One is at Kames Corner, other is in Kanduli, and third is in Mesgav. So those who wish to connect with Dr. Deepak Garg, if at all you need any kind of service, please feel free to contact Dr. Deepak Garg team on the given number on the screen. I will also share same information in the chat box later on. And if at all you want to have some consultation done, you can write email on info@eyesolutions.in. Dr. Deepak Garg is a dear friend and known to me. We are in same business group, so I know his capabilities, and that's why all who are authority on the specific topic, they come on Mind Parachute Show. And yes, Dr. Deepak Garg has enlightened all of us on beautiful ways of doing exercise for our eye. And there was a myth before starting the show that increased screen time, due to online classes, may tend to have glasses or numbers for my child. So I have overcome this myth now, so I have no problem. Only thing is, in between, if my child is not taking break, because a break is generally given after 45 minutes, or two topics are discussed. So you gave one good tip. Okay, just say hello to your child and distract your child. Just by distracting your child, it blinks, and that gives some exercise to eye, and the strain may go down. So these are best guidance we have got today on this live show. So before I end, doctor, your Last shot.
Sorry, you broke at
Before,
1 second.
okay, before I end today's live show, your last shot on this show, some last
Some tip.
guidance tips.
My main thing to tell, especially parents, is to not really worry. I think that's my main thing. Nothing is going to happen because of 4 or 5 months of crazy amount of screen time. You can only control it to the extent you can.
Mhm.
You don't have to worry about it every day. And do the few things that I said of taking breaks, having water, blinking your eyes, and
Mhm.
that will actually help your child a lot, and even
Mhm.
adults actually. And it
Mhm.
will, and hopefully you won't be as stressed out.
Wow. So it is so easy. I know many were stressed before the show, and the way my stress level has gone down immediately after you said this. Because when we started, you started with this only. Don't take tension. So I'm sure it has benefited all our live viewers. So before we end, I humbly request all live viewers to please subscribe to YouTube channel of Mind Parachute Show, and also like Facebook page of Mind Parachute. And if you need any kind of advice, any kind of consultation, please feel free to connect with Eye Solutions. And for that, mobile number is displayed on the screen, email ID is displayed on the screen. Please take advantage of this show and take consultation from Dr. Garg's team. uh, they are available in Mumbai, and anybody who's watching this show can take the advantage. Thank you, Doctor, once again, and thanks for coming on the show and sharing best of the best knowledge. The most important is you made us stress free. One, second, you explained so many good points at very easy manner. So I don't think I'm ever going to forget this, what you shared today. So, having water, blinking at regular interval, and looking far. These are the three main medicines we can give it to our eye without consuming any other outside medicines. So, thank you so much. And yes, we will follow what you said. Thank you, doctor.
Thank you so much for having me. Pleasure being here.